Great, I think we'll go ahead and get started. So good morning, good afternoon, and good evening from wherever you're joining us from. First of all, I'd like to welcome everyone on behalf of the Boost community and the World Health Organization. My name is Liz Colway, and I'm the Director of Community Building and Digital Engagement at the Sabin Vaccine Institute, which hosts the Boost community. We've been excited for this fellowship to start, and we hope that you'll find the program impactful to your day-to-day work as immunization professionals. From delving into several COVID-19 recovery topics in the live sessions, to engaging with your esteemed peers, of which we have several on the line today. Next slide. Before we get started, I want to go over some logistics for today's session. If you would prefer to listen to the session in French, we encourage you to select the interpretation button in the meeting controls at the bottom of your screen. You should see a globe icon. During this session, you can engage in dialogue with your peers and session facilitators through the chat. Please also use this forum to ask questions throughout the session, which we'll get to at the end during a Q&A section. Once we get to that Q&A section, we may have some time to answer your questions, so you can use the raise your hand feature to voice over your question if time does permit. Finally, please remember to rename yourself, your first name, family name, then country, so that we can record your attendance for this session. So that's very important because I know a number of you came in under different accounts. Please also note that the session is being recorded in both English and French. The recordings, along with today's presentation in both languages, will be provided to attendees early next week via email. Next slide. In just a few short weeks of sharing out news of this fellowship, we had an overwhelming response from around the world. The map here on the screen highlights where applicants indicated they were from. It would also be great to understand who is exactly joining us today. So next slide. To that end, we're going to launch a quick poll, no more than 15 seconds. If you could please tell us what region you're joining us from, that would be great. Great. Jen, would you mind sharing the poll results for us, please?
Can you see all those?
I cannot. I'm not sure if either you can or one of our other hosts could share.
I can verbally share them. Yeah. Sorry. So okay. The African region, 57%. 5% of you are joining us from the Americas, 19% from Southeast Asia, 6% from Europe, 10% from Eastern Mediterranean region, and lastly, 2% from the Western Pacific region.
Great. Thanks so much, Jen. And then we just have one more poll. So if you wouldn't mind relaunching that, at what level of the system do you work?
Sorry, Liz, that is not popping up. Hold on one second.
Yep, no problem.
I just launched it.
Great, thanks, Laura. It wasn't popping up for me.
Great, we'll just give everyone about 15 seconds. So if you could quickly select your option, that would be great. All right, Laura, if you wouldn't mind just closing the poll and sharing out those results with us, that would be great.
Can you see the results?
I think we probably do you mind sharing? I can't see them, so if you wouldn't mind sharing them, that would be great. Or verbally sharing them.
So we have 4% of those participants here today from the global level, 17% from the regional, 42% at national level and 38% at subnational level. So welcome, everybody.
Great, thanks so much, Laura. So in addition, we heard that nearly 80% of our applicants are currently working on or planning to implement immunization recovery or strengthening efforts in their country. So that's exciting because that's obviously why we are here doing this fellowship program over the next few months. Next slide, please. So I know that many of you heard about this fellowship through colleagues, so you may be new to the Boost community. For those that are new, Boost is a global community that connects immunization professionals to peers, supports, and resources to learn and grow, and equips professionals to lead in challenging situations. Boost launched just prior to the pandemic, and as a result, we have largely operated virtually through our online platform, boostcommunity.org. To date, we have nearly 2,700 immunization professionals from over 140 countries on the Boost platform. In 2021 alone, the Boost team delivered 75 virtual trainings and live engagements on our foundational capacity building blocks of community organizing and adaptive leadership, as well as several other key immunization topics, such as addressing vaccine hesitancy, supporting supervisors during COVID-19, and developing life course immunization programs. Today, we are again thrilled to be launching this new fellowship program with the World Health Organization to support you and your teams as you seek to strengthen your immunization programs. Next slide. Just in terms of who we are at Boost, myself, along with my colleagues MJ and Aisha, will be supporting you all throughout this fellowship journey. I'm sure you've already seen a few emails or messages from us today. We're also here with our WHO team, who will introduce in just a second, along with a number of mentors that will be serving in the mentorship program just a little bit later on in the program. Next slide. I quickly want to point out two main virtual tools that the fellowship facilitators and support team will be using throughout this program to both communicate with you and also to help connect with others. So first is our Boost Learning group on the Boost Community online platform. This group, which looks similar to a Facebook group, will be used to store recordings, slides, and other resources after each live session, interact with fellows, facilitators, and mentors by sharing experiences and asking questions, and also to stay up to date with fellowship news and live session reminders. There are more details on how to use the learning group in the About section. We will be posting reflection questions after each session to this group forum. So we do strongly encourage you to join the group, and I've actually highlighted the button at the top right-hand corner of your screen in order to follow along. If you do join the group, you can opt into either a daily or weekly digest of all the group's activity. Next slide. We'll also be using a Boost Telegram channel to quickly engage with peers and fellowship facilitators, troubleshoot any technical issues you might have, and also to receive session reminders. You can also email us at info@boostcommunity.org if for some reason your questions are not answered in those spaces. We do ask for your patience as we've received a large volume of inquiries about the fellowship program. And I do greatly appreciate all who have stepped up to share Zoom meeting details and other pertinent information in the Telegram and Boost Learning group to make sure that your colleagues are ready to begin the fellowship. Next slide. So without further ado, I'd like to introduce my colleagues from the Essential Program on Immunization at the World Health Organization, who will be leading today's session. We have Samir Soda, who's the Medical Officer of Program Strengthening, Laura McLaughlin, who's the Technical Officer of Life Course and Integration, and Stephanie Schindel, who is also a Technical Officer of Life Course and Integration. Next slide. I think just one more point on my end. This is just the agenda for today's session. We first will kick things off as I hand things over to Samir for justification and context for this fellowship on COVID-19 recovery for routine immunization programs. I'll then go into a brief overview of the fellowship program and expectations. And then lastly, we will dive into closing immunity gaps and recovering immunization programs. This is part one of a few-part series. And then last but not least, we will save time for question and answer So again, feel free to share those questions in the chat. So with that, I'm going to hand things over to Samir, and MJ, if you wouldn't mind turning to the next slide, that would be great.
And next slide again. Thank you, Liz. So to understand the rationale behind this fellowship, it's important to understand the current context. The COVID-19 pandemic led to major backsliding for childhood vaccinations in 2020. DTP3 coverage, as seen in the line graph on the right, dropped in 2020 back to the 2009 level of 83%. And if you look at the horizontal bars on the bottom right, you can see from 2019 to 2020, there was an increase of 3.7 million children that were under-vaccinated. Nearly 23 million children in total missed out on basic vaccines through routine immunization services in 2020. And most of these children, approximately 17 million or 75%, were zero-dose children, meaning they did not receive a single routine vaccine. Next slide. During the pandemic, WHO has published guiding principles on immunization with endorsement from the Strategic Advisory Group of Experts on Immunization, or SAGE. The first was published in March 2020 in the context of knowing very little about the virus at that time. The second was published in November 2020, after it was well known that severe disruptions to health services had been occurring and how immunizations need to be adapted accordingly. But since that time, the situation has evolved with Delta and Omicron variants, challenges with COVID-19 vaccine supply, delivery, and demand, and the ongoing challenges to recover health systems and catch up children with vaccinations missed during disruptions. Next slide. With that in mind, WHO has now developed, with SAGE endorsement again, the next set of guiding principles related to recovering, building resiliency, and strengthening immunization in 2022 and beyond. These guiding principles have two main sections, one on closing immunity gaps and recovering immunization programs, and the other on strengthening routine immunization and building resiliency. These guiding principles are in the process of getting published, hopefully by the end of the month. Given the current challenges, and with the next set of guiding principles about to be published, we felt that this was an opportune time to start this fellowship. Next slide. Last year, the Immunization Agenda 2030 was launched as the global immunization strategy for the next decade. This fellowship is rooted in the vision, strategic priorities, and core principles of the IA 2030. The vision is for a world where everyone, everywhere, at every age, fully benefits from vaccines for good health and well-being. Next slide. There are 7 strategic priorities to the IA 2030. The first being the orange one at the top, immunization programs for primary healthcare, followed by commitment and demand, coverage and equity, life course and integration, outbreaks and emergencies, supply and sustainability, and research and innovation. The core principles are being people-centered, country or locally owned depending on your context, partnership-based, and data-guided. This fellowship will touch upon all of these strategic priorities and core principles during the next several weeks. Next slide. There are also a couple of topics that are cross-cutting that you'll learn about through the fellowship. First, there's the focus on zero dose. And just as a reminder, zero dose children refers to children that have not received any routine vaccines. But you may also hear the term zero dose communities, which refers to communities with a large proportion of zero dose children. So why do we focus on zero dose? First, it's an equity issue because zero dose children tend to cluster in the most marginalized and neglected communities, such as poor urban, remote rural, and conflict affected areas. Second, it's a primary healthcare issue. Zero dose communities often have no regular health services overall and are not just deprived of immunization. And then it's a health security issue. Zero dose children tend to live in communities that are most vulnerable to outbreaks, and they themselves are most vulnerable to the morbidity and mortality associated with outbreaks. Next slide. The other cross-cutting topic that you'll come across in the fellowship is regarding gender and why it matters to immunization. Gender-related barriers can be found across the system, and to address them, we need to change the way we think about our programs. Gender matters for caregivers. It may limit their ability to make choices and act on them. It may lead to multiple access barriers. It can cause limited education and health literacy, which impacts their health-seeking behavior. And it may cause them to receive poor quality of care. But gender also plays a role with health workers. It impacts their recruitment, retention, training, pay, and promotions. And of course, safety and security impact their ability to provide services. Moving forward, we all need to be mindful of gender-related barriers and gender-responsive strategies. And in case you're curious to learn more, we recently published on the right this document on why gender matters. Next slide. Now I hand it back to you, Liz.
Great, thanks so much, Samir. So I think with that, we're going to go ahead and launch another poll question. So Laura, if you still have access, then you can launch that poll question for just about 15 seconds. That would be great. So we're curious, which of the following topics are the most important for you to recover from your immunization program? So we have a long list of topics, and we ask that you select all that apply. Just to confirm with my co-host that you can see the poll.
So far, 25% of participants have answered the question. So it's a long question, so we will give them a little bit more time to respond.
Sure. Give it another 15, 20 seconds.
Okay, 60% have participated. So will we stop the poll or do you want to wait another couple of seconds?
Maybe just give it a few more seconds. Okay, go for it.
Great, so over 70%. So I'm sharing the results. I don't know if other people can let me know if they can see that. But in terms of priorities, catch-up vaccination, 60% of respondents said that was a priority, followed by integrating immunization with other health interventions, followed by reducing missed opportunities or reducing zero-dose children and reducing missed opportunities for vaccination, using information data for action, reducing vaccine hesitancy. Yeah, so I think those are kind of the key ones. So thank you everybody for sharing your priorities.
Great, thanks so much, Laura. And we can go ahead and go to the next slide, please. So before I continue on and give you just a brief overview of the fellowship, I do want to remind folks that might have joined a little bit after the start of the hour that this session is available in French as well. So if you just toggle to the interpretation button at the bottom of your screen, you should be able to select French. And again, the recordings will be available after the session ends. Probably about 3 to 5 days, we will send out an email with both the live session recording along with the slides in both English and French. Great. So if you go to the next slide, please. So again, this is a 6-month fellowship in English and French that will be running from May to December of this year. The first phase of the fellowship will begin with 8 mandatory weekly live engagements led by subject matter experts on topics relating to recovery, building resiliency, and strengthening immunization. We do encourage you to attend all sessions. We also understand that life is busy and sometimes there's conflicting schedules. So for some reason you cannot make a session, we do ask that you review the recording and slides and that you fill out a post-session survey so that we can confirm that you have indeed reviewed the materials. And this makes sure that you're ready for the entire duration of the fellowship, and also can make sure that you have all the tools that you need in order to work on your strategic proposal or case study. So during both phases, there will be 2 different tracks. We have track A, which is developing a COVID-19 recovery strategic proposal, or you can take track B, which is developing a case study documenting strategies previously used for COVID-19 recovery. Regardless of track, again, fellows will be required to attend all live sessions, submit post-session surveys after each session, and submit their proposal or case study in order to receive a certificate of completion. For the next phase, select fellows will be mentored to further develop their strategy, receive implementation support, and publish a case study or report. Again, individuals who are selected for the mentorship program will be required to take their proposals towards implementation and also to document their progress through a case study in order to receive a certificate of achievement. So again, there are two opportunities to receive a certificate, but you do have to complete the requirements for both tracks and both phases. Next slide, please. I did just want to go over the format of these live engagements. So we'll start off with a presentation by a subject matter expert or a panel of speakers. There will be some Q&A after the topic presented, and then we will be using breakout rooms in the future for small group discussion. The first session is a little bit different from others, but we do plan on following this format. Again, after each live session, we ask that you complete a post-session survey. We will share a link both at the end of the session and also through a follow-up email. We also ask that you work on a strategic proposal or case study, and this is once the template is shared in the next couple weeks. And then we also ask that you continue engagement and discussion on a forum through either the Boost Learning Group or the Telegram channel, the two channels that I described earlier during the session. And then again, after the live engagement series, a certificate of completion may be issued if you meet all the attendance requirements and submit a strategic proposal or case study. And again, those proposals or case studies will be reviewed for selection to proceed to phase 2 of the fellowship, which is that mentorship program. Next slide. Here, I just showcased all the topics that we'll be covering over the next 8 weeks. This list of topics will also be available through the learning group and follow-up materials. You'll also notice in the learning group that we have a live sessions tab, and that way you can make sure that all of the calendar invites and the session details are on your calendar so that you're ready to go for each session. Next slide. So with that, I'm going to hand it over to Stephanie, who is our subject matter expert from WHO, who will be going over catch-up vaccination and reducing missed opportunities for vaccination. So over to you, Stephanie.
Thank you. Can you hear me okay?
Yes, we can, loud and clear.
Great. Thanks, Liz. So next slide, please. So just before we kick off this section, I wanted to stop and just pause for a second and think about what exactly we mean when we talk about catch-up vaccination and missed opportunities for vaccination. These terms are going to be used a lot over the course of today and throughout the fellowship. So I want to make sure we're all on the same page on the definitions. So maybe if you could just put in the chat what you think of when you think of catch-up vaccination and missed opportunities, what you already know about these routine immunization terms. Just give a few minutes to see if people can throw their thoughts into the chat. And in the meantime, maybe Liz, if you can get the next slide, please. So these you can see on the screen here. These are our WHO definitions of catch-up vaccination and missed opportunities for vaccination, also often referred to just as MOV. And so catch-up vaccination, I know a lot of times people tend to think about campaigns, catch-up campaigns, and sort of large, concerted effort strategies, but really catch-up vaccination is much broader and in a way more simple than that. It's simply referring to any vaccination of an individual who's missing a dose for which they're eligible. So this could refer to children, infants, and also adults. Anytime someone needs a vaccine, is eligible for a vaccine, but has missed it for some way, catching them up on that is what we are talking about when we're talking about catch-up. And missed opportunities for vaccination is a very related concept. And, in fact, we're referring to basically any contact with a health service with an individual who is eligible for vaccination, but does not get vaccinated on that time. So these are very related, and you'll see a little bit more in the second half of the session. Laura will give you more details on the MOV portion of this, but keep these definitions and terminology in mind as we go forward. And next slide, please. So why right now are catch-up vaccination and reducing missed opportunities for vaccination even more relevant? And again, if you could just throw some thoughts into the chat, please, about why now of all times, why these conversations are even more important to have. And we can go to the next slide, please, in the meantime. So of course, it's always important to catch up anybody who's missed their vaccinations. But now, given the circumstances of the last few years and the interruptions in regular service delivery that a lot of our countries have faced as a result of the COVID pandemic, we have many children and adults who have missed out on their scheduled vaccines. As Samir touched on earlier in the session, we have a severe impact on coverage in some settings. We know that there is an ever more urgent need to catch up these children and adults who have missed out on their vaccines, because we are having larger growing immunity gaps in some of these communities. And that, of course, is posing an increasing risk of vaccine preventable disease outbreaks. Next slide, please. So when I mentioned missed opportunities for vaccination, anytime anyone presents at a health service is an opportunity to provide that vaccination. But a lot of times and in a lot of settings, people are missing out on this opportunity, and that's for a variety of reasons. It may be because there's not a policy in the country for catch-up vaccination. It also could be because of the lack of health worker understanding around some of the schedules and permissible age ranges for which vaccines can be given if they were missed in the original schedule. And also we do see that in some settings, there are strict cutoffs for when people can actually continue to receive vaccines that are missed. And this prevents the opportunity for individuals to get caught up if they, for whatever reason, were not able to get their vaccination on time. So these can lead to issues with equity. And of course, the main message that I want to really hammer when we're talking about this is that no one should miss out on vaccination just because they weren't able to access the services in time. Making sure that we integrate services and offering catch-up opportunities across a life course and as part of regular routine immunization program strengthening can help address these barriers. And so this is what we're going to go into a little bit more detail on today. Next slide, please. Next slide, please. So I'm hoping that some of you on this call are already familiar with this document. This is a guidance document that was published by WHO in the summer of 2020. And it was timed quite urgently in line with when we were seeing a lot of program interruptions because of COVID. But in fact, we're really talking about an overall concept of catch-up vaccination within the routine immunization program. And there's actually a lot of elements around catch-up vaccination. It's not only the strategy for actually delivering those catch-up vaccines, but as you can see here in this diagram, there's considerations for catch-up that need to be integrated into your program planning across the whole entire spectrum. And of course, we don't have a lot of time today to go through each of these portions of this beach ball in incredible detail, but I really do encourage you, if you haven't seen this guide yet, to go to the link there, and you'll get these slides afterwards, and take a look through this document, because it covers these in a lot more detail than we're able to cover today. And it explains the different ways that immunization programs should be thinking about catch-up when they're doing their planning across all aspects of the program. Next slide, please. And so on that note about the actual delivery of catch-up vaccination, it kind of falls into two camps. And so as you can see on this slide, on the left-hand side, we have some actions that I assume are already happening in a lot of your country programs right now, maybe not all of them, but hopefully some of them, and maybe it's just a matter of intensifying, strengthening those aspects of the program. But these are about ways to ensure that children or adults who miss vaccination are offered opportunities for catching that up within the ongoing delivery of the essential immunization program delivery. On the right-hand side, you can see some points, some activities that might need to be implemented when you have a large-scale disruption to the program, which, as we know, because of COVID over the last few years, has happened in a lot of settings. And so these are different actions that can be planned as either a one-off or maybe an intensified effort to catch larger groups of individuals when you're dealing with a significant program interruption. And as it says at the bottom of this slide, multiple strategies will be needed. This isn't one or another conversation. It's really all about exploring all the different ways simultaneously that individuals who have missed vaccines can be identified and caught up. And this is covered in a lot of detail in the guide that was on the previous slide. Next slide, please. And so when thinking about the different strategies from the previous slide to employ, of course, this is going to be very context specific, and particularly now when we're talking about recovery in a post-COVID setting, or in some cases, while COVID transmission is still ongoing and impacting the delivery of programs, there are a number of factors that need to be weighed to decide what are the best, most feasible, and the capacity with the resources at hand that can actually be utilized in order to deliver these vaccines to these individuals. And so these are some considerations on this slide. I won't get into detail about all of them, but just to say that it's really context specific, and that this will need to be taken into account when mapping out your delivery strategies for catch-up vaccination. Next slide, please. So at the heart of all of this, though, the one thing that can actually really prevent any of these strategies in being successful is if there is not a clear catch-up vaccination policy in the country. And so I know a lot of countries already do have one, which is great, and some countries don't. And so this is really the opportunity to kind of look at what the policy framework is in your setting and see and ensure that it actually does provide for and allow for catch-up vaccination. And so, of course, the NITAGs are going to be instrumental in this conversation. And these discussions should really look at, what does your immunization policy and framework in the country say about age restrictions, about multi-dose vial policies, about limitations on where vaccination can or cannot take place? Because these are the types of things that might actually hinder the ability to deliver vaccines late when individuals miss their initial scheduled vaccines. And so if there isn't already a vaccine schedule that provides for delayed or interrupted doses and guidance that goes along with that in place, then now is really the time to look at that, develop some, and get it out to your health workers, and so that they understand what to do when individuals come late and have missed their previous doses. Now, I know that policy revision can be a lengthy process in some cases, and so when we're talking about rapid recovery of RI, there may be opportunities, depending on your country setting, to issue interim guidance, which is just temporarily lifting of some of these cutoffs in order to ensure that we can close these immunity gaps. But ultimately, we want this to be a sustainable policy that is integrated into the routine program going forward. Next slide, please. And so this is kind of linked to the slide that I showed a few slides back, where you're looking at all the different aspects to consider when planning your the best strategies for catch up. And of course, that's going to depend on the extent of the disruption. This is also very different in countries and also within countries. We know some settings had much more severe disruptions due to pandemic restrictions on movement or lockdowns, and therefore they might be dealing with a longer or larger gap in sized immunity gap that they need to be considering. In other places, there was actually a great success in continuing services throughout the peak of the COVID waves. And so there might be smaller interruptions, and maybe just a catch up through routine is is sufficient. And so it's just to say, look at the data that you have available to you and review the situation at hand to decide what the best strategies are to employ. Of course, the high-risk communities that you all know of that are always a struggle to ensure access to vaccines are probably also the ones that were impacted the most through the program interruptions. And so focusing your catch-up strategies on the known high-risk communities is going to be a good strategy to try to achieve that equity. And of course, if you have the resources and the capacity in countries to conduct a risk assessment to determine what are the best and highest priority strategies for these target areas, then that's definitely an advisable option. Next slide, please. And so along with this, of course, ensuring that there's available vaccines and supplies is going to be important. This is, again, just another example of how this should just kind of be built into the overall planning of routine immunization program delivery, making sure that there's sufficient buffer stock so that if you are going out with an intensified catch-up effort in a short time, then you can accommodate for hopefully a large number of individuals that do come for their catch-up vaccines at that time. Next slide, please. And so this, of course, also comes back to our favorite topic is home-based records and the very, very critical importance of recording and reporting. So one of the biggest challenges with catch-up vaccination is that, of course, if there's not a great record-keeping system, both at the individual level and also at the facility level for which vaccines an individual has received or has missed, it's going to be very difficult for the health worker to be able to determine which vaccines they are due and provide that catch-up. So this is just yet another opportunity to emphasize this importance. And then, of course, depending on how the recording tools and cards are designed in your setting, this might actually also present a problem for the health workers when they're delivering vaccines to individuals that are later than the typical schedule, because sometimes we see that recording tools are designed with limitations in the dates that vaccines can be recorded. And so if this is the case in your country, this is an opportunity when you're doing the policy revision around catch-up to ensure that you also revise the tools that can be developed along with these policy changes. And then the important thing to note is that even if the tools don't provide the right spaces for recording late doses, just record them anyways. Health workers are very innovative in coming up with their own solutions for recording things on tools that don't necessarily have the spaces in place. And we know that's great, but if there can be systematized guidance that goes out on this so that health workers aren't confused or having to invent their own solutions, then that's obviously better. It'll make it easier also for you at the national and subnational levels to be able to monitor this and be able to track the progress in catching up these individuals. And so ensuring that your tools are designed to facilitate the provision of catch-up vaccination or late vaccination is obviously going to help everything at all levels of the program. Next slide, please. I think I touched on this a little bit earlier, so maybe in the interest of time, we can skip through this quickly, but it's just to say that, of course, training and disseminating guidance documents out to all levels is of critical importance, because this might reflect a policy change or something that isn't normally a given practice for health workers. And so you'll want to make sure that they have the right guidance available to them and opportunities for learning more about this strategy so that there's consistency in how it's applied throughout the country. And then, of course, this also goes along with any sort of new practices or training that needs to be done to ensure continuity of service delivery throughout any ongoing COVID transmission that might still be happening in some of these settings as we're talking about this recovery. Next slide, please. So multiple injections, we already know that this is a concern in some places. And when you're dealing with catch-up vaccination and potentially providing additional vaccines for individuals, that come and have multiple vaccines that they need to be caught up with, this sort of raises the issue back up to the forefront again. And so it's yet another opportunity for ensuring that health workers are comfortable with this. Multiple injections is a very common thing, and it's a given case with a lot of the immunization schedules that we see today. And so we want to make sure that health workers are themselves able to comfortably communicate the safety and benefits of multiple injections, to ensure that parents are comfortable with their children receiving multiple injections. And WHO has a lot of resources on this at the link that's provided on the slide there, that can be provided to the service delivery level to ensure that this is a practice that they're comfortable with. As it says here, if concerns remain, caregivers should not be pressured. Of course, you don't want to be pressuring people to receive all of their catch-up vaccines in one go, but it's a lot easier if they can. It reduces dropouts, and of course, it means that we can close those immunity gaps as quick as possible if all the vaccines can be given at one go. Next slide, please. And then, of course, it's important to also to remember about the communication aspect of all of this. Getting people to come back, ensuring that communities are aware and understand that even if they had missed their vaccine, that doesn't mean they're no longer eligible. It means it's still important, better late than never. These are the kind of messages that it's really important to get out there into the community, making sure that everybody is well aware of where they can come to receive their vaccines, when they can come to receive their vaccines. And it's really just, it's just getting that message out there of, it's not too late, it's still important, you still benefit from protection, and making people feel comfortable and empowered to come to the facilities to get their vaccines, even if late. Next slide, please. And so these are just some examples of some of the posters that were designed sort of earlier on in the pandemic, when we were noticing, being aware that there were a lot of service interruptions and people were missing out on vaccines. But basically just to say that, this can all be done through the routine service delivery. I know almost all programs have some sort of default or tracing in place that they would normally employ. And this is just a matter of intensifying that. I mean, the systems in a lot of cases are already there. They just might need to be strengthened. And it's just, on a larger scale than maybe they're normally used to doing. But I know that a lot of these, the basic systems are already in place in a lot of places. Next slide, please. We've seen some really innovative examples of how to get out to the communities and make vaccination more accessible when trying to catch up, larger groups of people, especially in settings that still are dealing with, ongoing COVID transmission, and people might not necessarily feel comfortable to come to crowded places, or restrictions may not allow for that. There are very innovative ways to kind of get around this. We've seen some countries do these drive-through immunizations, or setting up small clinics in places where people are going anyways, open air markets, things like this. And so it's just, this is an opportunity to be creative and expand the locations where vaccination is offered, be outside of the traditional spaces that we're used to dealing with. Next slide, please. And of course, as schools open back up again, this is another great place to leverage. I know that school-based immunization was interrupted in some settings for 1 or 2 years because of the pandemic. And so for HPV vaccine programs in particular, there will be additional cohorts to catch up. And of course, it's still important to do that, even if there is a longer interval, for example, between the first and the second doses, it's still important to give that second dose. And so it's important to emphasize that, even if they had missed it on their original schedule, they can still get it, and it's still important. And then, of course, using schools and daycares for vaccination checks, it's a good opportunity to be able to check and review, maybe there were missed vaccines from even prior to the pandemic that can still be caught up. These kids are still potentially vulnerable to VPDs and can still benefit from vaccination. And so, when you're thinking about catch-up vaccination, you can also think about how this can sustainably be integrated into a program, for example, of school vaccination checks, even going forward in the future. Next slide, please. And just in closing, of course, in summary, the principle of reducing missed opportunities for vaccination is the main take-home message that we want to convey. Every time an individual comes in contact with a health service provider is an opportunity for reviewing their vaccination history and providing vaccination for any of the doses that they're missing. So integrating this with other primary health activities, even if somebody comes to a health center for a curative visit or something that has nothing to do with the immunization, they're at the center, and it's a low-hanging fruit. They're right there, and so ensuring that these concepts are just embedded in the practice throughout the health facilities is the main message for reducing missed opportunities for vaccination. But Laura will go through all of that in more detail, and so I will turn over to her now, I think, to continue on this.
Thank you, Stephanie. Hello, everybody. My name is Laura. I'm the focal point for missed opportunity of vaccination. So it's great that we have the opportunity today to talk about that. So on the next slide, we can see that there's a question for you guys to input into the chat. So what are some of the common reasons for missed opportunities for vaccination, or as we call it, MOV? And as mentioned before, the definition of a missed opportunity for vaccination is any contact with health services by an individual who is eligible for vaccination but does not result in vaccination. So I can see some people writing here, multi-dose vial, which is true. Lack of poor communication and high workload. Yeah, these are all exactly some of the reasons why we see problems, rupture of vaccine shortage and poor integration. So thank you, everybody. I think you're all very good and well aware of what we can do. And we're going to go on to the next slide and kind of show some highlights of what are the common causes of MOV. So based on some of the work that we have done over the past couple of years, just so you know, the MOV strategy has been around since like the late 1980s, and it was revitalized in 2015. And as part of the revitalization, we carried out assessments in a number of countries. And over that time, we've been able to collect information on what are the common causes, and it can be broken down into 3 areas. We first begin with caregivers. Sometimes caregivers do not bring the home-based record or the vaccination card to the health facility. And this poses a problem because then it's difficult then for the health worker to screen and see what that child is eligible for. Sometimes the caregiver is not aware of the schedule, so they don't know when the child is meant to come for their next vaccination, or they don't know when their child has missed out on vaccines because they can't understand or follow the schedule. Sometimes also we have problems with caregivers having low confidence or acceptance of vaccines. And this is something that we really want to try and avoid, because vaccines, as we know, save lives. And by ensuring that caregivers have confidence in our immunization program, we can really help protect and save children from getting preventable diseases. If we look at the health system itself, as some of you mentioned in the chat, integration is a problem in that there's a lack of integration. And as Stephanie mentioned, sometimes when children come for non-immunization visits, they often are not screened, and nobody looks at their home-based record or vaccination card. So then they are not referred to immunization. So we have children who are coming to our health facilities, they're in contact with health staff, but then they leave without getting a vaccine for which they're eligible. So say, for example, a child who may be 10 or 11 months old, missed getting their first measles vaccination at 9 months, comes to a health facility maybe for a growth check or a well child visit, and the health worker doesn't refer that child to immunization, even though they may be eligible or they are eligible for measles vaccination. And then in the coming weeks, potentially, an outbreak may begin and that child will get very sick. And that could have been prevented if that child had been screened at that time. So that's one of the reasons we see reasons for MOV. We also see that limited hours. In many countries, we know that health facilities are only open for certain hours, or there are only certain days for certain vaccines, or there's only certain days for vaccination, full stop. So I know that many countries have policies in place that say that vaccination should be available every day, but I'm sure many of you are aware that in your own communities, that sometimes the health facilities are not open on a certain day, or they may decide that they're only giving certain vaccines on a certain day. And this really prevents an issue for MOV, because we sometimes see then that if a caregiver makes an effort to visit our health facility and then the service is not available, this really creates, I suppose, nobody would be happy with that situation. So it may disincentivize that caregiver for coming back in the future, because they think, oh, whenever I go to the health facility, it's never open or they never have vaccines. So it's really important that we ensure that we have clear hours for vaccination to be made available, and that vaccines are available every day. As Stephanie touched on in the catch-up vaccination area, the restricted policies on age limits is a real problem for missed opportunities, and it's a real problem for not ensuring that children are well protected. So in some countries, if a child is above a certain age, the health worker will not give a vaccine. But in fact, we know that there is no reason not to give a vaccine above a certain age. For example, if a child is 18 months old and hasn't received their first dose of measles, they can still receive their first dose of measles even though they're 18 months old. So I know that many people would be worried about how they're going to record and report this, but we want to emphasize the importance of ensuring that there are policies in place, that health workers know when they can and can't give vaccination. And just to say that many countries have very flexible policies for providing vaccination, and particularly if we have colleagues on the line from the Southeast Asian region, they've actually changed their policies as a result of COVID-19 to ensure that they can actually catch up children up to 5 years or above that with vaccines that were missed during the pandemic. We have to think about that children who maybe were due vaccines during the pandemic are sometimes too old now to receive some vaccines, but they're not. They can receive these. So it's important that we emphasize, with our, as Stephanie mentioned, we have these national immunization technical advisory groups. So we have advisory groups that decide on what the upper limits are for vaccinations, and then our program managers then are responsible for them communicating across all levels about what those policies are. And I think it's very important that we think about those children who are susceptible to infection and how we can catch them up. Also, as mentioned by Stephanie, home-based records or vaccination cards are very important. And this is a topic that a lot of people, don't really want to discuss because it's they don't think it's very important. But actually the home-based record or vaccination card is very, very, very essential for immunization. This is how we know what a child has received, or a mother or an adult. This is how we know which vaccines they're due. And sometimes cards are very well done in that they also show when the person is to come for the next visit. This record is very important for that caregiver to have for that child for many years, because sometimes countries also have school entry screening. So having this card well protected, well looked after, bring it to every health facility contact can ensure that that child is caught up. We know what their vaccination status is, and also for school entry screening that we know that they have been caught up with everything, or if they require catch-up, then that's made available. Finally, there's two other issues, is that stock out of supplies. So that also is a health system issue. And I'm sure many of you have already mentioned in the chat about stock out is a critical reason for missed opportunities. We see that some people are not sure when they come to health facility if certain supplies will be available. This is a supply chain issue. It's also a planning issue from either the national or subnational district level. So this is something that the health system can rectify and ensure that they have something, make sure that they have stock available for each health facility so that everybody can access the services they need. In addition, other policies can also interfere with missed opportunities. And this includes like the multi-dose file. Sometimes some caregiver or health workers don't open a certain, sometimes the multi-dose files because they feel that they'd be wasting some of the vaccine if they don't use all of it. However, I think I want to emphasize really clearly that we want to think more about utilization rather than wastage. So it's better that we use the vaccines when we have individuals there rather than thinking about wasting them, because we're not wasting because we're protecting lives. So that's something that we need to consider. Rather than worrying about wasting doses, we need to think about how many we're using. Finally, on the health worker side, as mentioned, not screening the vaccination status of those who are attending. This happens both at the immunization side, but also the non-immunization side. This can be problematic whereby some health workers, don't understand or don't know how to really effectively screen a child to see their eligibility. And this also causes confusion sometimes around whether a child is eligible or not for catch-up. And this also is something that is an issue in terms of health workers not being aware of what are the true contraindications for vaccination. So these are some things that are definitely, some leads to MOV. So on the next slide, so we talked about common causes of missed opportunities for vaccination, but I want to ask you, what do you think are the proportion of children and women who experience a missed opportunity for vaccination? So please, in the chat, put in what you think are the proportion of children and women who experience the MOV. So some people are saying 10%, 20%, 30%, 25%. Okay, so we're getting a very big mix of proportions here. So on the next slide, we'll show that actually 1 in 3 children, so it's over 30%, and 50% of women, 1 in 2 women experience MOV. So this means that of the 3, if there were 3 children who are attending a health facility today, 1 of those will have a missed opportunity for vaccination. Whereas for women, if 2 are attending a health facility, 1 of those will have a MOV. So it's quite high. And actually, we've done some estimates in different countries following MOV assessments, and we found that the proportion can be even higher. And we'll go through a country example shortly from Kenya, which will show you the extent of missed opportunity vaccination. So just to say that the proportion, this is the global proportion, it's based on a study, a systematic review that was done a couple of years ago. But just to say that it's very country specific, and in some cases, the proportion can be even higher. Next slide. So as I mentioned, the missed opportunity for vaccination strategy is something that's been around since the late 1980s and was revitalized in 2015. And the strategy really tries to focus on 3 key areas, and it takes both a qualitative and a quantitative approach. So what we want to do is understand how many opportunities are being missed. So we do that by carrying out exit interviews with mothers and caregivers. We want to understand why are the opportunities for vaccination being missed at the different vaccination sites. So we carry out key informant interviews we carry out knowledge, attitude and practice questionnaires with health workers. And we also carry out focus group discussions with mothers, caregivers and health workers. So that helps us understand why these opportunities are being missed. And then we want to understand what can be adjusted or done differently. And we do that by carrying out in-depth interviews with key informants. So that's with health facility managers, people at national level, at district level. And we also carry out brainstorming sessions. So this is what the MOV strategy encompasses. It's an approach to look at how many, why, and what. And this is really a way that we can ensure that we have a comprehensive overview of what is leading to people being missed in the population. Next slide. So the MOV strategy is made up of 10 steps. So if a country was to really want to try and identify why MOV is happening, and it doesn't necessarily have to be done at a country level, it could be done at a state or a district level, or even a health facility level. If you want to see why children are being missed, you can carry out a small MOV assessment. So as part of the assessment, we try to plan and prepare for the strategy. Then some fieldwork is carried out where you collect the data, analyze it, have a brainstorm where you discuss with people what could be possible interventions to reduce missed opportunities, and then you debrief with some of the people in the ministry and also with partners. Then the next step, and the key step, and it's always the key step, is implementation and monitoring of interventions. So when you decide that you want to try and implement some interventions, you have to think about how you're going to monitor and follow that. So there are some key steps in terms of implementing the agreed upon interventions, provide supported supervision. And I know that supported supervision is an area that many of you are involved in, and it's a very important and key area. And it helps you monitor progress and kind of see how things are happening at a health facility level. And then we try and advocate that people conduct a rapid impact evaluation and incorporate any interventions that were shown to be successful into the long-term health plans. And these assessments are used in a way to be actionable solutions for reducing missed opportunity vaccination, and ensures that people who are accessing health facilities are able to be identified, caught up, and they're up to date with their vaccines. Next slide. So as I mentioned, we're going to touch on an MOV assessment that was carried out in Kenya. So this, in the next slide, this assessment was carried out in 2016. And the reason why Kenya wanted to carry out an MOV assessment is to understand why a high proportion of their birth cohort were under-vaccinated. And what they found when they carried out the assessment was that 75% of children who were eligible for vaccination actually experienced an MOV. And in 57% of those cases, some children received no vaccine doses at all. So what we see sometimes in missed opportunity vaccination assessments, some children receive some, but not all doses. But then we see that some children receive no doses. So we see that the proportion MOV was very high in Kenya. And we see that some children really did not receive any vaccine doses at all. And this is an example of something that is happening in every country, all around the world, every day, but it can be prevented. Next slide. So Kenya, they did their assessment, really wanted to focus on why this was happening. Why were they seeing this high proportion of MOV? So what we found out was that some health workers were not asking for the vaccination history. Some health workers did not understand the vaccine schedule. Some caregivers reported they were unsure of the vaccines their child needed. And also there was issues with stock out supplies, mainly related to vaccines being unavailable, syringes, home-based records, or also other health facility records for recording vaccination history. So these results really helped the country to identify which activities they needed to implement, such as standardizing health worker practices, and this should and will lead to improvement in vaccination coverage. Next slide. Now I'm going to touch on another example from another country. So this is from Cambodia. And in Cambodia, they did what we call the MOV Light strategy. So the MOV Light strategy is whereby you move straight to implementing interventions. So if I'm in a particular country, I know I have a problem with children being missed. I know that I've had maybe a reduction in coverage of late. I know that potentially there was some stock out issues, or there was some issues with policy dissemination. I can move straight to implementing interventions. So rather than planning for assessment and carrying out fieldwork, it's more like carrying out a situation analysis at the country level. And this is what we did in Cambodia, whereby people from different sectors of the immunization program got together. They had a brainstorming meeting where they went through where were some of the bottlenecks and issues that they were facing in the program. They also had people not only from national level, but subnational level and health facility level to really discuss amongst each other what could be done to improve the program. So like I said, it involves countries whereby they already know the existence and causes of missed opportunities for vaccination. And also it involves reviewing existing data and conducting a workshop and brainstorm on what interventions can be done to reduce MOV. So this was something that was done in Cambodia. And what they did was they held a 3-day workshop and they discussed all the challenges and I tried to identify solutions. And I have to say that it was a very good opportunity, I suppose, for different sectors of the program to get together from the different levels to discuss this. And this is something that some countries could do if they really want to try and address why they're seeing missed opportunity for vaccination, how they can try and address increasing coverage. And in the end, the result of this workshop was an action plan to reduce MOV at both national and subnational levels. So this is the success that led from this workshop. I think it's something that can be applied to others in other countries if you have good data available. Next slide. Great. So these are just some of the resources that we have. I know that throughout the whole meeting, we've been placing all the resources that we mentioned in the chat function. So these will all be made available. This will also be made available online through the Boost Learning Program. So make sure that you go there and avail of these resources, because as we mentioned, as part of the fellowship, we'll be anticipating that you create plans. And as part of that, you'll be reliant on these resources to help develop your plans. So huge thank you to everybody for your for paying attention. And I think we're going to switch over to some Q&A now.
Great, thanks so much, Laura. And we have been receiving a fair number of questions through the chat box. So again, continue to send some of your questions there. I might kick things off. And I think the first question we have is around catch-up vaccination. So the question is, could the integrated management of childhood and newborn illness approach in the community be considered as one of the strategies for catching up with children passing through health facilities or health centers and community sites? So maybe over to Stephanie, if you're still there. Or perhaps Laura as well.
Yeah, no, thank you. I think this concept of IMNCI, so this is the Integrated Management of Childhood Illnesses, it's called PCEMNE in French. So I think that this approach is something that it's very good if it's carried out correctly or if it's carried out full stop. So one thing I want to say is, based on the MOV assessment that we've done, is that we see that when children are visiting for non-immunization visits, nobody screens or refers them for immunization. So I think that this strategy, if it was being fully implemented, would be excellent for reducing missed opportunities and increasing catch-up vaccination. However, in many countries, it isn't being done. Even though there's a clear checklist of some of the steps that a health worker has to do, has to look at the card and review it and see if that child is due any vaccines, we see that this is not unfortunately happening. So if countries can implement stronger integrated management of childhood illnesses, I think it would be great, but I think more needs to be done and more training amongst health workers needs to be done to ensure that that can be done effectively.
Great, thanks so much, Laura. And I know we have some hands raised, but I want to address a few other questions that came in a little bit earlier. So our next question is around how can the irregularity in reporting from private settings be overcome? I'm not sure if anyone wants to address that. I know that we'll also be addressing some of these questions in the Boost Learning group after this session. So definitely, if we don't get to your questions today, we can do so in that learning group in between sessions.
Stephanie, do you want to touch on the point on the private providers?
Yes, sorry, and sorry about before. I had something going on at the same time. So I think that the first thing I would ask in response to that question is, to try to figure out why the reporting is coming in irregularly, and then that could obviously dictate how that could be addressed. But I do know that in some programs have had success in making arrangements with private facilities to provide them the vaccine through the Central National Immunization Program procurement system, so that they're getting the vaccines for free. So in exchange for providing the data and reporting on administration. So it's an arrangement that works really well because it's of benefit to the private centers who have access to the vaccines. It ensures consistent quality in supply across the country so that the communities are confident that they're getting the same quality assured vaccine from the private sector and from the public system. And the deal is that the private facilities provide that data in exchange for the vaccine. So that's one way that that I know has been met with success in countries. We do also have a WHO guidance document on engagement with private providers. I can provide that link in the chat as well, which provides some of these innovative solutions and ideas of how to better engage with the private sector and ensure continuity across the quality of care that's being provided in the countries. I don't know if any of my colleagues have anything to add to that.
Well, I was just going to add that, when they have that type of arrangement, it's usually done through an MOU or a memorandum of understanding that's often formally done, where they establish that in exchange for the vaccine, we get the data. But it's not only about the incentive of getting the vaccine, it might be access to the trainings that might be offered to the public sector. Private sector may want to be part of that as well. So there's other ways to incentivize them to be part of the system as well.
Yeah, I fully agree with Samir. I think sometimes what we see in countries is that some people have either greater trust or less trust in the private system versus public system. And I think ensuring that everybody has the same level of training and same level of engagement, that only helps to increase confidence, but then also it should also help with trying to ensure that there is better collaboration and sharing of information. So I think that is one thing that I think is key, and it's something we've seen in a number of countries, whereby different levels of confidence amongst people in the different systems, but also we know that sometimes people favor private over public because of the waiting times. But I think at the end of the day, it's important that we have, wherever we're providing vaccination, that we have the same level of confidence in both.
Great. So I know we have several other questions to get through, so I'm going to highlight a few others. So with limited resources, how can catch-up campaigns be planned? And sorry, hold on one second. So I think the question is around, with limited resources, how can you use those resources to implement catch-up campaigns? Especially when there's a time of a financial crunch.
Samir, do you want to answer this?
Okay, yeah, maybe Samir.
Yeah, well, I'll start. So I think there's multiple strategies at play here. I think part of the reason that we strongly encourage for countries to have routine immunization systems set up to provide catch-up vaccination is that it reduces the need for the campaign. So if you already have those systems in place, it doesn't necessitate that there be a campaign. But of course, there's certain times where there's significant disruptions and there's probably a higher urgency where you may need to have a campaign. So one approach is that some countries may already have campaigns planned. For instance, they may already be planning a measles campaign. And we've already seen in the last couple of years what countries have done. They already have a planned measles campaign, but with that campaign, they're looking to provide catch-up vaccination for other antigens as well. So what they're trying to do essentially is integrate as much as possible to leverage the limited resources.
Great, thanks, Samir. So another question that we have coming in a situation where children are missed for vaccination and the child is due for about 4 doses, do you give all the antigens at once?
And so, yes, I'm glad someone asked this, but and I touched on it briefly in the presentation, and the importance of ensuring health workers are comfortable with administering and also communicating to parents and caregivers the safety and efficacy of multiple injections. And so the answer is yes. I mean, of course, you should look at exactly which vaccines are in question, but most vaccines in the schedule are already scheduled to be given at the same time as other antigens. And depending on the country we're talking about, you probably have visits where children are receiving 2 or 3 vaccines at a time. And many countries have schedules that require children to receive 4 or even 5 vaccines on the same visit. So multiple injections is very, very common globally. And it really is the best way to ensure that the children or individual in question is caught up as quickly as possible and protected as quickly as possible. So the answer is yes, given at the same time. But along with that, understanding that there needs to be the adequate training in place so that the health worker themselves is comfortable with this. In issues with multiple injections, studies have actually found that it's oftentimes the health worker that's more uncomfortable with the idea of giving multiple injections than the caregiver themselves. Studies have found that the caregiver trusts the health worker's opinion, and if the health worker is confident and comfortable in being able to communicate to the parents that this is of benefit to them and the child, they don't have to come back for another visit, they get protected as soon as possible, it's safe to give them all at the same time, then the caregiver will accept that. But oftentimes the health workers themselves are the ones that are uncertain about this. So it really emphasizes the importance of making sure that training addresses this, and that health workers themselves are confident with that practice.
And I'd like to also touch on more of what Stephanie said. And I think it's very true that we often see that sometimes actually it is the health worker who is the one who is hesitant, because I think they're concerned about adverse events following immunization. And I think what we have to consider thinking about is the individual that we're delivering the vaccine to. That person has made a decision to come to the health facility. They've taken time away from their daily life to come and wait and then access our services. So we need to ensure that if that individual is coming and the child is due for those vaccines, granted that they should be, depending on the vaccine, that there are the required intervals between, we can't give all of a certain series at the one time, they have to be the correct intervals. But if at a specific moment in time that child is due for a certain number of different antigens, that they receive those, because if we tell the mother to come back next week and the week after, we may lose that caregiver. And what we see is when we look at the vaccine schedule, we see that we have children receiving vaccines at birth, so they're at the health facility, so they receive those vaccines. For the first doses in the series, we sometimes see quite high uptake at 6 weeks, depending on the country's schedule. But then as time goes on throughout the period of the schedule, we see that the number of children being vaccinated reduces. And sometimes it could be either because of maybe the caregiver had a bad interaction at the health facility and maybe is discouraged from returning, or because life gets busy and the caregiver isn't aware of the schedule and doesn't know when to come back. So I think ensuring that we have health workers that have strong confidence in what they're doing, that strongly communicate what the child will be receiving that day. I think that's also another thing. Sometimes we talk to caregivers and we ask them, what vaccines did your child receive today? And they can't tell you. So it's all about communication. Communication is key. It's key for everything we do, not just for vaccination, everything we do in life. So I think that's something that is really important, and it's an important thing to remember.
I just want to add that I think we should also be sensitive to the fact that right now, more so than ever before, the health workers are particularly overstretched, stressed, burned out, feeling a bit neglected as well. So I think we do need to focus on them to address some of these issues related to vaccine hesitancy, for instance, but we also have to have a certain level of empathy that they feel like they've been abandoned by the system to a certain extent. I think they deserve a certain level of attention at this point in time that needs to be addressed.
Great. Thanks, Samir and Lara. So I know we're getting a ton more questions in. We won't be able to address all of them during this live session, but again, we'll be taking a note of all of these questions, and we'll address as many as we can through the Boost Learning group. I do want to ask maybe one last question before we move on to some reflection questions and next steps. So we've received a few questions around a missed opportunity for vaccination in both urban and rural settings. And I'm wondering if perhaps one of our speakers can talk about strategies to address both or either setting.
Hi, everybody. So In terms of missed opportunities of vaccination strategies in both rural and urban settings, urban and rural, we actually, when we carry out assessments, we look at both in order to see if there are different interventions that are required. Granted that these are both very different issues, whereby sometimes in the urban settings, we have populations who are mobile or maybe are coming in and out at certain periods of the year because of maybe work-related commitments, whereas in the rural settings, sometimes it can be that maybe health facilities are not as frequently available, and distance and getting to health facilities is difficult. But the strategy is available and is feasible to be operated for both urban and rural. There are sometimes often different strategies or interventions that have to be considered for the rural or for the urban setting, particularly considering that oftentimes caregivers really don't have a whole lot of time to be accessing health facilities and queuing and waiting, whereas in other times in the more rural setting, in order to catch up and find those people that have been missed, having more frequent outreach sessions is something that is more feasible and operationable. So, but just to say that in order to identify reasons for missed opportunities in urban and rural settings, the strategy is applicable to both.
Great, thanks so much, Laura. Oh, and Samira, you want to add?
Yeah, I just want to add, I mean, it's not necessarily about missed opportunities, but about this important topic about the distinction between rural and urban immunization. And I think it's good to see that there's a greater recognition about the challenges in these different settings. To be very frank, I think our immunization programs for 40 years were designed around the rural setting, right? We designed our programs based on a single health worker working with a defined population, and they were the single provider, and that population was relatively stable. And that has its own unique challenges for sure, especially because you have to deal with these outreaches, which are challenging, et cetera. But the urban setting is such a completely different setting. We have, multiple providers. It's, private providers sometimes, mobile populations. It's a much more difficult scenario based, our traditional microplans don't always work in that scenario as well. So I think it calls for us to have a little bit of an open-mindedness and perhaps a little bit of innovation about how we operate. And as we alluded to earlier, perhaps seeking out partnerships with other, outside the public sector, with private sector, with NGOs, et cetera, on trying to deliver these services and collecting the data. It requires us to work in just a completely different way of working than what we've done traditionally.
Great, thanks so much, Samir. I am mindful of time, and I want to honor everyone's time with us today and appreciate you taking time out of your busy schedule. So I think what we might do is just move on to the next slide, if you don't mind, MJ. So we did have a couple of reflection questions, and this is something not necessarily to answer right now, but to reflect on between today's session and next week. And we will be posting these to the forum section of the Boost Learning group, which I know we'll share links to in the chat. So the first question that we have for you all is, what do you hope to achieve with this fellowship? And then the next question is, what is the main problem currently impacting your immunization program? And how do you plan to address it through this fellowship? So two separate questions. Again, we'll set these up in the forum so that you can comment there, and then also view your peers' answers and comment on their post as well. Next slide. And just a reminder that the next session will take place again next week at the same time, which is 12 p.m. GMT, 1 p.m. West Africa time, 3 p.m. East Africa time, and 5:30 p.m. India Standard Time. If you're in another time zone, we also send out a link so that you can compare time zones and make sure that that you're arriving at the right time. And that session will be a continuation of closing immunity gaps and recovering immunization programs. And this time it'll be focused around life course and integration. Next slide. I do want to remind you of a few ways to continue the conversation from today. First, you can join the Boost Learning group. And again, in this forum, you'll be able to access the session recordings and slides. Again, the recordings and slides will be available in both English and French. You can also interact with your peers in advance of the next session and answer those reflection questions in that group. Again, we also have a fellowship Telegram channel, which you can easily access conversations and engage with your peers through this mobile app. We'll also be sharing out reminders a day in advance and an hour in advance of the session so that you make sure that it's on your schedule. And then last but not least, I want to remind everyone to take our post-session survey, which again, the link will be in the chat box. We'll also send it out through the Telegram channel right after this session ends. We do want to hear from you. We'll be using feedback that we receive in those post-session surveys to improve future sessions as best we can through the remainder of this series. And then again, a reminder that in order to receive a certificate of completion for this first phase, we do ask that you participate in the entire live engagement series, complete all post-session surveys, and submit your proposal or case study. Again, that template we will share in the next week or two so that you can start working on those plans and case studies. And as a result, you will receive a certificate of completion if you complete those steps. And then again, if you have any additional questions, you can always email us at info@boostcommunity.org. I think that's all I have, but just want to make sure I hit the next slide. So again, really want to thank Laura, Stephanie, and Samir for your excellent presentations today. And also want to thank everyone in attendance of today's session for engaging so much in the chat. I'm sorry that we didn't get to everyone's questions, but again, we will be doing so through the Boost Learning Group. So be sure to join us there. And in the meantime, enjoy the rest of your week. And we'll see you next Wednesday. Thank you, everyone.